Hey folks, Professor Finn here, and today we're going to be looking at Chapter 23 of Embalming, History, Theory, and Practice by Sharon Gee-Mascarello. Let's go ahead and get the screen shared. And let's talk about the effects of drugs on the embalming process. So first up, proteins, the chemistry of proteins. Proteins are responsible for the structure, function, and regulation of the body's tissues and organs. During embalming, proteinaceous materials within the dead human body must be rendered chemically inert. Proteinaceous materials are those that contain protein. Essentially, this means that decomposition is halted or suspended for a time that exceeds the memorial event or until the time of final disposition. Proteins are labile substances that break down rapidly even without bacterial action. And the word labile means easily altered or broken down. Proteolytic enzymes are specialized enzymes that break down protein. Enzymes are endowed with a physicochemical structure that allows catalytic activity. They can speed up decomposition reactions. Even if a cadaver were completely sterile or free from bacteria and microbes, the proteolytic enzymes in the cells and tissues of that body would still be fully active and capable of causing the breakdown of tissue proteins. The preservation objective of embalming is to render the proteins resistant to attack by these catalytic enzymes. And there are two ways to do this. The proteins themselves can be treated so that they are no longer susceptible to the action of the enzymes, or the enzymes can be changed or inactivated so that they cannot exert catalytic action on proteins. Modern embalming chemicals are formulated to do both. So the chemotherapy case. Many chemotherapeutic agents are nephrotoxic and can decrease kidney function. If you are taking medications for any conditions, you likely have to go annually to see your doctor for blood testing to do exactly this: test your kidney functions. Since the kidneys are the main organs responsible for elimination of nitrogenous wastes, waste materials such as ammonia, urea, and uric acid are retained in the tissues. There is no better way to neutralize formaldehyde than to react it with ammonia. If there has been a buildup of nitrogenous waste materials as a result of chemotherapy-induced kidney dysfunction, a moderate arterial solution will not be sufficient. Fancy way of saying that if you have these complications of kidney failure, reaching for your medium index stuff, probably not the best idea. A large portion of the formaldehyde in the embalming solution will be neutralized when it encounters the nitrogenous wastes in the body. The remainder is insufficient to preserve the tissues, and the body begins to undergo post-mortem putrefactive changes. Strong solution strengths are recommended. An embalming fluid containing 30% formaldehyde supplies 142 grams of formaldehyde per bottle. To embalm a body containing 10.7 kilograms of protein, or 10,700 grams of protein, 470 grams of formaldehyde is needed. That is a minimum of 3 bottles of arterial embalming fluid. Double this amount may be necessary when therapeutic drug therapies were administered. So if you're watching people embalm with 2 bottles and 250 pounds and they have complicating conditions, chances are pretty good you're not meeting the formaldehyde demand for that body. One axiom could be universally applicable to all drugs that enter the body regardless of the method of delivery: cellular and tissue changes will occur. Drug-induced changes may be relatively minor. Post-mortem, a minor skin discoloration will respond favorably to cosmetic treatments. Intense complications such as acute jaundice can saturate the body tissues with uremic wastes. The fixative action of the preservative chemical during arterial embalming will be impaired. Chemotherapeutic agents exert numerous effects: impairment of organs and systems within the body, decreased kidney, liver, and lung function, changes in the circulatory system and heart and blood vessels, and changes of the skin. Drugs can decrease permeability of the cell membrane, making it difficult for embalming solution to enter the cell and denature cellular proteins. Hair follicles are commonly affected. Hair loss, or alopecia, is a common side effect of chemotherapy. The liver is the main detoxification center, and every drug eventually enters the hepatic circulation. While in the liver, the drug may be changed to an innocuous form by hepatic enzymes, or the drug may cause profound changes in the liver itself. When the liver is damaged, the embalmer may encounter a jaundiced body. All drugs ultimately pass through the kidneys. Kidney damage leads to renal insufficiency and the resulting buildup of nitrogenous wastes in body tissues. Saturated with urea, uric acid, ammonia, creatinine, and other wastes, the tissues become spongy and difficult to preserve. In such cases, preservation treatment must also be modified. Drugs also change the biochemical constituents of the blood and can damage the blood vessels. The circulatory system may become blocked as a result of extensive clot formation, lysis of the blood cells, or extensive damage to the walls of the arteries and veins. The effects on the skin are closely associated with the changes in the circulatory system. Widespread areas of discoloration caused during hemolysis can be hemorrhages, ecchymoses, and purpura. Essentially, bruising. So, drug therapy upon embalming. Embalming preservation challenges do not result from direct reaction between the drug and the preservative. The drug causes physiological changes in the body. Think about what we just learned. We're putting in 3 bottles of embalming fluid with 470 grams of formaldehyde. How many thousands of grams of protein are there, as well as all the other materials in the body? Lots of stuff, right? How much is in a pill? Milligrams. There certainly is not enough drug in the body to have any significant effect on what we are putting in. The issue becomes what the drug does to the body, especially over the long term. The physiological conditions present in the body create the embalming challenges. For example, a drug that causes nephrotoxic changes enhances the accumulation of nitrogenous waste products in the body. These waste products, which result indirectly from the physiological effect of the drug, are responsible for the inactivation, or more specifically, the neutralization of the formaldehyde. Drug causes problem with kidneys, waste build up. Waste is the problem because it neutralizes the embalming material. The neutralization reaction, whereby formaldehyde is converted to hexamethylene, is probably at the root of at least 90% of the preservation challenges. Changes in cellular membrane permeability is another effect of systemically administered drugs. It is through this membrane that everything must pass, either to enter or leave the cell. Preservative chemicals such as formaldehyde must pass through the cell membrane to inactivate the intracellular enzymes that cause protein decomposition. When a chemotherapeutic agent reduces or destroys membrane permeability, preservative solution cannot pass through. The antibiotic tetracycline is a case in point. Although most antibiotics exert their effect on bacteria, they also have an effect on the human cell. They are chelating agents and tend to lodge in the cell membrane, causing calcium to form an impenetrable layer around the cell. Chelating means they have an affinity for metallic ions, particularly calcium and magnesium. Antibiotics appear to act selectively on cell membranes. After they are entrenched in the membrane, they start chelating or sequestering calcium and magnesium ions. There is generally not a shortage of calcium in the body. Calcium is present in all biological fluids. Eventually, as more calcium and magnesium ions become lodged in the cell membrane, the permeability of the membrane changes. It becomes increasingly more difficult for some chemicals to enter such a cell. Multi-drug therapies. 2 or more drugs may be prescribed together to treat a single disease or condition, called a multi-drug approach or combination therapy. The embalming challenges resulting from synergistic combinations of drugs can be more intense than the effects caused by a single drug. First up, we have antibiotics. Antibiotics are the most widely used class of drugs. Antibiotics are used to treat or prevent some bacterial infections. They are not effective against viral infections. Long-term antibiotic use can cause liver damage and kidney failure, which causes tissues to become saturated with ammonia and nitrogen waste. Higher index arterial fluids and strong hypertonic solutions are necessary to compensate for waste products that neutralize formaldehyde. Firming of tissues may be difficult to achieve. Anti-inflammatories. Cortisone and its derivatives may constitute a close second for their wide applications and common use. Corticosteroids are commonly used for chemotherapeutic cancer treatment. Anti-inflammatory drugs primarily reduce inflammation. Non-steroidal anti-inflammatory drugs, or NSAIDs, are pain relievers. With regard to specific embalming problems caused by these drugs, the chief effect is the blockage of the cell membrane. Corticosteroids decrease the permeability of this membrane and thereby block passage of liquids into the cell. On a gross macroscopic level, liquids are retained by the cells and tissues, resulting in an increase in cell turgor and waterlogging of tissues. And cell turgor refers to the rigidity of cells from the absorption of liquids. The use of cortisone for the treatment of chronic diseases may result in gastrointestinal ulcerations and perforations of the gut. Prolonged use in the treatment of ulcerative colitis can result in dehydration of the body. Corticosteroids have been shown to exert a protective effect on proteolytic enzymes. This is demonstrated by the challenge of denaturing enzymes in cortisone-treated bodies. Even if these enzymes are extracted from such cortisone-treated tissues and are obtained in an almost pure form, they are still difficult to inactivate. They retain the protective effect originally conferred by the corticosteroid. Such bodies tend to decompose very rapidly after an uncomplicated embalming. Fancy way of saying, if you are on a corticosteroid, it is leveling up your protein enzymes. And even if you take the enzymes out of the body and then try to hit them with formaldehyde, formaldehyde will then have a limited effect on it because of that protection. Progesterone, an oral contraceptive, and its derivatives have chemical structures similar to that of cortisone. Embalming reactions observed from corticosteroid therapies are similar to the reactions observed from oral contraceptive use. Long-term use of corticosteroids suppresses immunity. Reactivation of the mycobacterium responsible for tuberculosis creates an undetectable hazard to the embalmer. Personal protective equipment to cover the mouth and nose of the embalmer is a best practice during any type of decedent care. Sufficient room air exchanges that produce fresh air will reduce circulation of harmful airborne populations in the preparation area. Pre-injection and co-injection types of fluids restore cell membrane permeability. The surface active chemicals in the formulation facilitates entry of the preservative across the membrane. So generally speaking, if you have a body that is being treated with anti-inflammatories or oral contraceptives, because it's all based off of the same stuff, cortisone, using a pre-injection fluid is a wise idea. But you must take into account the totality of what you see in the body. And the rule of thumb is, if the body is complicated, pre-injection should not be used, which means your pre-injection should become a co-injection. Put the anticoagulant or the co-injection into the embalming tank with your arterial preservative. Chemotherapeutic agents. Cancer chemotherapy agents are classified according to their chemical nature and function. Some of the common cancer chemotherapy agents include the alkylating agents, plant alkaloids, antimetabolites, anthracyclines, topoisomerase inhibitors, and corticosteroids. These drugs are cytotoxic, meaning they are capable of damaging or killing cells. Cyto meaning cell, toxic meaning poison. The basic mechanism of cytotoxic drugs is to cause immunosuppression by toxic effects to lymphocytes. Cytotoxic drugs slow the growth of quickly dividing cells. They are commonly used to treat leukemias and cancers of the breast, ovary, and intestinal tract. Antimetabolite drugs are a type of cytotoxic drug. Antimetabolite drugs mimic the molecules that a cell requires for growth. The cell cannot differentiate between its own molecule and that of the mimicking version. The side effect of chemotherapeutic agents. The antemortem side effects of chemotherapeutic drug therapies can influence the postmortem conditions present in the dead body. Common side effects include diarrhea and vomiting, loss of appetite, loss of hair, again, alopecia, skin rashes and dry, cracked skin, inflammation of the mouth and lips, and higher levels of liver enzymes. Related postmortem conditions may include body and tissue dehydration, severe weight loss, hair loss, abdominal fluid retention, yellowish discoloration of the skin, and swollen features. Radioactive isotopes. Radioactive materials are also used for cancer therapy. Medical institutions provide some form of warning indicating exposure to radiation. A warning sticker may also be affixed to the body bag. The release paperwork should contain contact information for the institution's radiation safety officer. The institution is not permitted to release the body until the level of radioactivity has dropped below 30 millicuries for autopsied bodies or 5 millicuries for below for autopsied bodies. So the magic number: 30 for unautopsied bodies, whole bodies, 5 millicuries or below for autopsied bodies. 3 precautions are followed for embalming a body treated or exposed to radiation: protection, time of exposure, and distance from the body. Best practice for PPE selection includes the addition of heavy rubber gloves worn over standard surgical gloves, a heavy rubber apron, and all other applicable equipment. Universal precautions should be strictly followed. Task sharing is an effective method to reduce time of exposure and distance of exposure. During preparation, embalmers work in pairs and alternate embalming tasks. Having instruments ready and fluids mixed as soon as the body is observed reduces the time spent in preparation. Avoid raising a vessel where tissues have been seeded with a radioactive isotope for cancer treatment. Common implant areas include the upper chest and neck tissues. Selection of the femoral vessels for embalming is indicated in this case. For every 3 feet of distance from the body, exposure is reduced substantially. For every 3 feet of distance from the body, exposure is reduced substantially. When not performing a procedure, the embalmer should remain at a distance from the body. Maintain a constant flow of water onto the embalming table beneath the body, and positioning devices and body bridges support the body and allow water to flow freely. That way, any type of contaminated organic material will flow off the table and into the water system for further treatment. Terminal disinfection best practices regarding radioactive isotopes. Flush all instruments with running water before submerging in cold chemical sterilant. Dispose of soiled paper toweling, cotton, suture material, hospital gowns, and the like in the approved biohazard waste container. Washable gowns, towels, and clothing are readily laundered in-house or placed in a laundry bag for the service provider. Document the decedent's exposure to radiation on the embalming and decedent care report. Triage all exposure incidents and report for medical attention. Consult the radiation safety officer at the releasing institution. Opioids. Opioids are controlled substances used primarily in medicine for pain relief or anesthesia. Fentanyl is a common prescribed synthetic opioid similar to morphine, yet 500 to 1,000 times more potent. It is medically administered as an injection, a transdermal patch, or as an oral lozenge. Fentanyl is the drug most commonly attributed to overdose deaths in the United States. Direct skin contact with fentanyl poses a huge risk to the embalmer. PPE is required. Patches should not be manually removed by gloved hands, as gloves have pores that will expand with time and use. Transmission of the narcotic through the pores of the glove is possible. Safe removal of transdermal fentanyl patches require instrument usage and proper disposal. The biohazard sharps container is ideal. When a drug is taken beyond the time period prescribed in amounts larger than the prescribed dosage or without a prescription, it is termed drug abuse. Opioid use produces a state of euphoria in the user. Fentanyl has numerous routes of transmission: ingestion by pill or powder form, transdermal absorption, or mucous membrane absorption by eye drops or nasal sprays. PPE is advised to be worn during the transfer of the deceased. Fentanyl dust can adhere to clothing and mortuary caught fabrics. Remove contaminated PPE, launder transfer sheets, and clean all transfer equipment. The dangers of fentanyl cannot be understated. It is very important to realize that this is a very dangerous drug. If you go onto YouTube and you look at accidental fentanyl, law enforcement, as you search for accidental fentanyl, law enforcement as keywords, you will find more than a handful of videos where law enforcement officers encounter fentanyl during a traffic stop or during a search of a home, and just a simple touch starts putting people into cardiac arrest. Oral diabetes drugs. Drugs that treat diabetes can induce changes in the voluntary muscles and the liver. Voluntary muscles are a site of glycogen storage and breakdown, and the liver is the main glycogen storage organ of the body. Continuous use of oral diabetic agents has been linked with circulatory problems, which can cause poor distribution of the arterial solution. Acidosis sometimes occurs as a result of the altered carbohydrate metabolism and leads to the formation of high concentrations of lactic acid in muscle tissue. Such bodies form very rapidly unless an alkaline co-injection is used in combination with the arterial embalming fluid. Once absorbed into the bloodstream, a drug is rapidly diluted. An average body contains about 6 liters or 2.1 pints of blood. This entire volume of blood circulates once per minute and comes into contact with an additional 35 liters of liquid. Most oral dosages are measured in milligrams. Once the drug is absorbed into the bloodstream, it becomes diluted to the point where it becomes insignificant to the embalming process. The direct chemical reaction between the drug and the embalming preservative is negligible. You will never be able to take enough of a drug without it killing you prior to becoming a problem for the embalming solution. We are always worried about the physiological effect of the drug, especially long-term physiological effects on the body. This concludes this lecture, and we will see you next video. Don't forget to like, share, subscribe, grab a mortuary science friend, and introduce them to the channel. Everything helps the algorithm, and the more people we can help, the more funeral directors we get, and the happier employers become, folks. So thank you for your support of the channel, and good luck in your mortuary science education.